Hi, I'm Dr. Jonathan Chang, one of the physicians at Baptist Health Women's Clinic, North Little Rock. I was raised in a medical family. My mother was a nurse. My father was a physician, also in women's health. And so I've kind of always had that background, as well as been around a lot of people in medicine. My passion has kind of always been more in the science field, but my passion is people. And that kind of led me more into the medical field where we can mix science and people together and try to have good health outcomes. I'm actually from Central Arkansas. I was born in Jacksonville, Arkansas, was raised in North Little Rock, Arkansas, went to Little Rock Catholic High School, was then in college at the University of Arkansas at Fayetteville, and did my med school and my residency training at UAMS Medical Center. So at Baptist Health Women's Clinic, North Little Rock, we offer the full scope of women's health services. We do obstetrical care from, young, low-risk women to older, high-risk women. We offer a full gynecologic services. Our main focus is women's health preventative care. We hope to prevent you from having any major problems, but we also, our goal is to catch things before they become a serious issue. And so we like to follow women throughout their life from, young age all the way up until their older years. Our goal in the clinic is for patient-specific centered care. We want you to have a very good experience. We want your care to be patient-centered and tailored to each individual person. We want to do what is best and right for you, but we want you to be involved in every decision along the way that we make. I am a pretty avid tennis player. I've played tennis my whole life. It's one of the few sports that I can still do at this time. Like to fish, like anything Arkansas Razorbacks. If it involves Razorbacks basketball, football, baseball, it's woo pig suey all the way. Probably my biggest passion outside of medicine. So we recently moved from Mark Olson and Chang, our private practice group, and merged in with the Baptist Health Women's Clinic, North Little Rock. It's been a great experience. It's actually allowing us to provide more specific care with higher technological abilities. And we're happy to be here and happy to have all of our patients follow us over there, and excited for what the future holds for patient care there. Reasons women would want to come to the clinic, pre-pregnancy, during pregnancy, post-pregnancy, overall is just our ability to try to coach them through to keep them as healthy as possible. Pre-pregnancy, we like to talk about things they can be doing to prevent different diseases, things that they can be doing if they're considering pregnancy, looking at different medical conditions that they can improve if there's any improvement there before they consider getting pregnancy, getting started on prenatal vitamins. During pregnancy, is to make sure that we're optimizing their health and their baby's health, making sure that they're not taking any medications that are inappropriate, doing different examinations to make sure the baby is growing well, growing appropriate, getting ultrasounds done when appropriate to make sure that everything on the baby looks healthy. After pregnancy, specifically in the postpartum period, is to make sure that the mom is doing well, is bonding with her baby well, that there's no issues with postpartum depression, which can sneak up on about 1 in 6 to 1 in 8 women, so it's very common, and women don't talk about these things, and definitely things that we can manage. And then after pregnancy is just wellness care to make sure we're keeping women as healthy as they can be for their families, because moms tend to be kind of the cornerstone of the family, and so we want to make sure that they're healthy as can be for long-term longevity.